Good day, Dr. Nino, especially to our BTL and HE21 classmates.
We are the group 3 and we will discuss about the functional and rehabilitation model of disability.
But first, what is model of disability? It is a conceptual explanation of the process and underlying mechanism by which disease, injury, or birth defect impacts a person's ability to function. These models are helpful in understanding the process of how a person loses abilities and are important in the selection of interventions to address those losses. This model refers to a system of definition and theories about human disability that are used to provide a framework for discussion or to explain disabilities in relation to clinical diagnosis, rehabilitation medicine, employment issue, public policy making, and similar concerns.
So, what is functional model? This model of disability is similar to the medical model in that it conceptualizes disability as an impairment or deficit. So, the same as medical model, ani na model gihunahuna ang kakulangan ingon usa ka kadaot or kakulangan sa usa ka tawo. Okay, here in functional model, disability is caused by physical, medical, or cognitive deficits. The disability itself limits a person's functioning or the ability to perform functional activities. So, we have here an example. Okay, when someone has a disability under the functional model, if due to an underlying impairment such as mental retardation, unya mga condition such as cerebral palsy. So, kaning cerebral palsy, if you know kanang this condition, these people dili sila makatarog lakaw kay there is something problem sa ilang bones. So they are unable to perform vital physical or mental activities such as moving, breathing, working, or living independently.
In other words, the functional model, or also known as the medical model, has dominated the formulation of disability policy for years. Although we should not reject out of hand its therapeutic aspect, which may cure or elevate the physical and mental condition of many disabled people, well, it does not offer a realistic perspective from the viewpoint of disabled people themselves. To begin with, most would reject the concept of being abnormal. Also, the model imposes a paternalistic approach to problem solving, which, although well-intentioned, concentrates on care and ultimately provides justification for segregation. This restricts disabled people's opportunity to make choices, to control their lives, and develop their potential.
The rehabilitation model of disability. The rehabilitation model is very similar to the medical model. It regards the person with a disability as in need of services from a rehabilitation professional who can provide training, therapy, counseling, or other services to make up for the deficiency caused by the disability. Persons with disabilities have been very critical of both the medical model and the rehabilitation model. While medical intervention can be required by the individual at times, it is naive and simplistic to regard the medical system as the appropriate focus for disability-related policy matters. Many disabilities and chronic medical conditions will never be cured.
Rehabilitation, the combined and coordinated use of medical, educational, social, and vocational measures for training and retraining the individual to the highest possible level of functional ability. So here are the 4 types of rehabilitation. The first one is medical rehabilitation. Help a person better in all his daily physical and mental activities related to increasing the potential capabilities and correction of deformities, restoration of functions. Number 2 is social rehabilitation. Implies social life, restoration of family, social interactions, or relationship. The third one is psychological rehabilitation. Includes psychological restoration of personal dignity and confidence of disabled. The last one is vocational rehabilitation. Help those patients who find it difficulty to get employment.
Next is the principles of rehabilitation. Rehabilitation should begin during the initial contact with the patient. The emphasis of rehabilitation is to restore the patient in independence or pre-illness or pre-injuries level of function in a short time as possible. He must be an active participant and motivates the patient to help him to attain social independence.
The overall goal of functional rehabilitation is to train the patient using three-dimensional movements to prepare the whole body to return to daily activities or sports. This differs from therapies used to address the patient's symptoms using such modalities as heat, ice, and medication, while mainly strengthening the isolated, injured muscle. The athlete should begin rehabilitation as soon as the injury allows, and rehabilitation, which should be injury-specific, may allow a multi-phase program that involves progressive steps from controlling inflammation and pain to restoration of motion to development of muscle strength, power, and endurance to return to sport-specific activity. A team approach should involve rehabilitation physicians, physical therapists, athletic trainers, and strength and conditioning coaches.